Share if you care. Like, comment, subscribe. I want you to see what we do about scoliosis today. And scoliosis starts during adolescence. And the spine grows crooked. And no one knows really why, but the latest theory about scoliosis is that it comes from a flattening of the curvature of the neck. So I'm going to do a lot of work here. And this is my patient, Sam. And this is going out to the entire world, Sam. How about that? And I'm working with my hands on her neck, because if these bones are lined up, the rest of it tends to line up properly. But if there's not enough curve from the side of the neck, the spine will grow crooked, and they call that scoliosis. And it's more prevalent. It's 5 times more prevalent in women than in men. So it's a good idea to get your daughters to the chiropractor and get them checked before they go through puberty, so that they grow up straight and strong. Because as the twig grows, so grows the tree. And I'm going to start here. Sam, turn your face to the right, please. And start lining Sam up, and she might tell you how this feels today. Is this or this tender when I touch here or here?
No.
Good. How's this in here?
Slightly tender.
Slightly tender. Lining up her sacrum and opening up the spaces between the vertebrae where the discs are. And they're wondering how that feels. What would you tell someone who's never been to the chiropractor?
Ooh, it's kind of like it's like a quick, like massage almost.
Like massage almost.
Yeah.
All right. That's a good description. Here we go. Here we go. And I'm using a vibration, and the body vibrates at about 40 hertz. And I'm using her core frequency, a certain harmonic, to gently realign, rehabilitate, and restructure the spine. And this is the foundation, obviously. So she has a vertebra that's out of alignment here in her back. That's called vertebral subluxation. If the bones move out of alignment, it affects the nervous system. And I'm going to start lining her up. And you can see, if you look carefully, this side's higher than this, that there's a curvature here. We're going to start lining up her mid-back, her lower back, and straightening things out. And the earlier you treat scoliosis, the better, obviously, because as the twig grows, so grows the tree. And I'm going to check her hips. And I'm going to check the muscles in her legs. Here we go. Check this hip out too, and they should be even, and pretty much they are. So her hips are moving well. I'm checking the muscles in her legs. She doesn't have any knots in the muscles in her legs. I'm going to have her bring her head into the center. And I mentioned early on that the alignment of the neck is critical in idiopathic scoliosis. Idiopathic basically means stupid doctor. It means no one knows what causes the most common form of scoliosis. They call it idiopathic scoliosis because no one knows what causes it. But she's got a lot of tightness in her neck. There should be more resiliency here. It should move better than this. There's a little bit of swelling, and I could feel it with my hands. And I'm going to start lining up her neck, and I'm going to use a double prong attachment to gently realign, rehabilitate, and strengthen her neck and put a proper curve in the side of her neck. Her neck should be curved from the side, and I'm working. And I also have her on an exercise program to get the curve back in her neck. And after that adjustment, I can feel it. There's less swelling. It's moving better when I touch her neck. And I'm checking the movement of her neck from left to right. To the left, her neck moves readily. It moves easily. You can see it moves without any problem. But to the right, it's all locked up. It's all locked up to the right. So I'm going to make some adjustments here in her neck and start creating some balance deep inside at the level of the nervous system, because there are nerves obviously that come from the spine. And after the adjustment, it moves to the left better, and it moves to the right beautifully. So that's good. That's called an adjustment. Chiropractors adjust something called subluxation. She had bones that were out of alignment, for years, and we're adjusting them, and we could see after the adjustment that that's dramatically improved, that's better movement. And that's critical, because the current theories about scoliosis say it starts in the neck, and then the spine twists to compensate for lack of curvature in the cervical spine or neck area. And of course, we all carry stress here, so I'm going to make some adjustments over her shoulders, get rid of the knots in her shoulders, because we all carry stress here and here and here. And we're going to create some balance deep inside of her. Here we go. And I'm feeling with my hands where the vertebrae are out of alignment, and I'm using a handheld instrument to line up the thoracic vertebra and the rib that attaches to it. And I'm going to go down the spine because these bones are crooked. And you can see that this side of her spine, the right side, is more pronounced than the left side if you look carefully. Here we go, and we'll make some adjustments here, right here, so that she stands straighter and stronger, so that she's more balanced, so that this curvature doesn't get worse. Here we go. And I'm going to feel with my hands, because she's out of alignment here too. They call that a subluxation. And we're going to adjust her spine and take pressure off the nerves, because nerves come from the spine. There's a power that flows through us from the brain, through the spine to the living cells. And I'm working on the vertebrae or backbones. This is the thoracic part of the spine. And I'm working on the ribs that attach to it as well. And I'm gently realigning, rehabilitating, and restructuring her spine.